Symptoms that indicate a sinus infection, not a cold. A sinus infection, also known as sinusitis, is a very common upper respiratory tract infection that affects millions of people every year. It occurs when your nasal cavities become swollen and inflamed. But treating a sinus infection is often delayed because people do not recognize a sinus infection in the initial stage. 1. Pain in your face. One of the best ways to distinguish between a common cold and a sinus infection is the pain and pressure you feel in your face with an infection. The pain may be worse when you move your head forward or touch the areas overlying your sinus cavities. As the inflammation reduces and the infection clears, the pain will go away. 2. Yellowish or greenish discharge. Discolored nasal discharge, green, yellow, or blood-tinged, is another sign of a sinus infection. The nasal discharge you experience with a common cold is clear and more liquid in nature when suffering from a sinus infection. 3. Coughing up phlegm. A cough often accompanies a sinus infection, but many people assume it is due to a cold or bronchitis. Coughing due to a sinus infection usually is worse at night and in the morning. You can reduce the frequency and intensity of your coughing by sitting upright to sleep. It will also help you sleep better, which is important for recovery. 4. Bad breath. Bad breath, medically known as halitosis, is another common symptom of a sinus infection. In fact, they go hand in hand. As the bacteria are bathed in mucus, it causes bad breath. To improve the smell of your breath, maintain oral hygiene by brushing twice a day and flossing once daily. You can also use a mint-flavored mouthwash. 5. Toothache. Believe it or not, pain in the upper teeth is a fairly common symptom of a sinus infection. This pain is not an indication of an actual problem with a tooth. If you have a persistent toothache, consult your doctor to determine whether the pain is due to a sinus infection or other possible dental issues like periodontal disease, teeth grinding, cavities, or dental abscesses. 6. Stuffy ears. Along with a stuffy nose, a sinus infection can cause stuffy ears. It's a muffled ear sensation. Your sinuses and ears are connected inside your head. So, the congestion and inflammation of the nasal passages can affect the pressure in your ears. Also, a buildup of pressure in the inner ear can make you feel dizzy at times.